So hello, everyone. Thanks so much for joining us for the seventh of our monthly live virtual series, Beyond the Clinic, Living Well with Melanoma. I'm Dr. Emin Liu, oncologist and director of the Cancer Survivorship Program here at Kaiser Permanente San Francisco. In this special series for our melanoma community, we'll be exploring how to live well despite all the challenges we face every day. A couple of logistics as usual. I'll be monitoring the chat during the session today. We really want to make this a conversation with your input. So feel free to put things in the chat and send up questions to us that you would want answered. If there is an important issue or question you want to bring up, you can put them in all caps in the Q&A so they come to my attention easier. And we'll try to address as many issues as we can in our brief 30 minutes together. Today's special guest is Dr. Sage Bolte, Chief Philanthropy Officer and President of the Inova Health Foundation. She's a national expert in sexual health and cancer and has been speaking around topics related to image and cancer on the national stage. Welcome, Dr. Bolte. I was just thinking that maybe we start by, you want to give us a little bit about your background? I know you do a lot of work in social work for cancer patients too. So
Yeah, sure. So I know it's weird to hear Chief Philanthropy Officer and coming and talking about body image and sexual health. So a little bit about me. I have my PhD in social work. I've actually spent my entire career in oncology social work, and I'm a certified sex therapist. I still maintain some private practice with our oncology patients, and my heart, my passion is educating physicians and nurses on how to have these conversations with our oncology patients around body image and sexual health concerns related to cancer and cancer treatment. So I'm so excited to be here and look forward to this conversation.
You know, we often start these conversations with just normalizing how common these issues are, how much we don't get a chance to talk about it in the clinic. When I'm seeing a patient, you know, oftentimes we don't have time to talk about a lot of these things, but we know they're so important. So I want to get your perspective on that and what you've heard.
Yeah, so as you indicated, physicians and nurses don't always have time to have conversations about body image and sexual health as it relates to a diagnosis of cancer or cancer treatments. But that doesn't mean that it isn't hugely important. In fact, we know it is one of the top 6 issues in quality of life, both in treatment and in survivorship. It's a major issue related to how people manage their own sense of self, their interaction and their relationships. For single people or coupled people, the issues are different yet very real.
Yeah, there's like so many things we can get into. I know in our prior conversation, we're just delving into all these issues. But one of the things that I've been struck by is how we feel about our bodies really carries with us into the diagnosis. So do you want to talk to us a little bit about like how the stuff that we carry into the diagnosis can affect how we think about the diagnosis and beyond?
Sure. So part of my research was looking at this idea of the sexual self concept, which is how we think about ourselves, impacts the way we feel about ourselves, which impacts our behaviors, right? And we all come into cancer, no matter what our age, with old baggage and or old perceptions of ourself, whether that's I'm ugly, I'm not pretty enough, or I'm gorgeous, I'm handsome, I'm sexy, right? All of those self-views impact the way we're able to process the impact that cancer and its treatments have on our bodies overall. So if we have massive scar damage and we've had to deal with other issues prior to this diagnosis that have been hard, we're probably going to be able to adapt to some of that scarring in a different way than somebody who maybe has never faced some kind of trauma and or sees a scar as something that is marking, potentially damaging forever, has a negative self-view of oneself. So I gave the example when we were talking, if I wake up in the morning, the first thing out of my head is, oh my gosh, you look like that again. Aren't you going to get any better looking? Right? That statement right there, that thought is immediately going to trigger a negative feeling, and whether that's depression or anxiety, but that feeling is then going to drive our behaviors, and that behavior might be withdrawal from a partner, might be withdrawal from life, might be hiding. We might, find ourselves covering our bodies more. It might be that we're uncomfortable being touched, or it might be that we are, fully free and open and showing our scars and totally comfortable with it. But what we experienced previous to cancer and the thoughts that we associate with the changes that cancer brings absolutely impact that the way that we process and heal in our body image post-cancer.
Wow, that's so powerful, because you're saying that the feeling leads to like a behavior, and then the question then becomes, well, when that feeling leads to that behavior, how do we turn? And it's not a feeling necessarily that we want. For example, let's say it's guilt about something. Then how do we turn that into a positive, or how do we manage those feelings?
Yeah, so great question. You know, when we talk about guilt, I was describing to Dr. Liu before that sometimes with cancers like melanoma or other types of cancer that get associated with we caused it, right? Which is not at all always the case with melanoma, but it gets that same stigma as lung cancer, right? That there's this guilt of I did this to myself, or I hurt myself and therefore I'm hurting my family. So the best thing we can do in any circumstance when we notice a shaming or a negative self-statement is to catch it. We can't always change that initial thought, right? That initial thought might be, how could I have done this? But what we can do is change the way we react to it. So as I hear, how could I have done this? I can shift that to, I have incredible control over what I do with this, right? Whether that's educating and empowering my friends and family, whether that's making different choices in the way I live now, whether that's, you know what, I'm going to make sure that I am living the healthiest lifestyle that I can. And I am confident that my body will work with me to heal. That's a very different conversation than my body betrayed me. I did something to myself. That shame continues, and then I start thinking about how unworthy I am or how bad I am, which leads to negative outcomes. Usually it leads to greater depression, it leads to isolation with partnerships, families, and we don't always find ourselves getting out of that. So that first, we can't always catch the first thought, but if we can catch the second or third before it goes into the behavior that then creates a negative reaction, we can really save ourselves and the people that we love a lot of suffering if we can shift the conversation in our own head.
You know, it's so hard because some of those behaviors are wired, right? And so I think it's always like, is it okay? Is it okay to have those feelings? Can I get better? Is it like a muscle that I could practice using? And like, how much better can it get?
So I will tell you, I'm completely biased because I'm a cognitive behavioral theorist and therapist. So I absolutely believe that we have the ability to change at all times. We can't change those around us. We can't change how they respond. We can't always change our environment. But we do have control. And oftentimes when we're diagnosed with cancer, we're looking for something that we can control, right? We're looking for at least something that we have the ability to change. And what we can control is how we respond or react to our environment or the things around us or our thoughts. And that is a muscle, right? Our brain is one of the most important organisms, muscles that we have in our body that can absolutely change. And we talk about neuroplasticity of our brain, that we can change the way we think, rewire the way we respond to information. And it's a really powerful thing. So I may have been a depressed person all my life, potentially. And with potentially medication and good therapy, I can change the way I think or respond or interact with the world based on, again, making different choices and catching those thoughts and choosing a different behavior. And it sounds simplified, and I don't want to say that it's work. It's work, but it is doable and absolutely possible.
Wow, that is really powerful, because I think a lot of us just feel like with all those behaviors, we just get set in a rut, and sometimes it feels like it's hard to come out. But what you're saying, you've seen that people, and the science is showing that you can do that there's ability to change them and improve that, how the behaviors are relative to feelings and how to manage those.
Yeah, and I think what you also have control over is who you put in your life, right? If you have people who are tearing you down or reinforcing those negative messages, one of and I use this tongue in cheek, so I don't want anybody to misinterpret this, but one of the greatest gifts cancer can provide is a true reevaluation of who do I want in my world and who do I not want in my world. And it gives you an amazing excuse to get the people that you don't want in your world out of your world. Right? It's a great excuse to really reevaluate and say, you know what? I'm going to stop and take stock. Who is in my world that builds me up, that fills me up, that makes me feel good about who I am? Because the who I am is not just kind of my personality, right? It's all of me. And that's really important. So the opportunity to stop and think about who in your world also builds you up, makes you feel beautiful or handsome, or makes you, helps influence your confidence. So critical. And if you have people that are tearing you down or questioning that, you have the ability and control over how you choose to interact with those relationships. If it's your mother-in-law, you may not be able to cut her out.
Okay.
You can choose what you do and how you interact with that. And that might mean, before you go into a conversation with her, you're doing some meditation. You're doing some imagery around being your strong self, being centered, feeling confident, feeling sexy, whatever it is that you're trying to connect to, and that you have a barrier around you. I always think of like an invisible bubble that things can pop off of when negative messages are sent to me, that they can pop off of, so they're not penetrating. So again, using those tools, we have the ability to influence how we take in other people's comments.
So how do we do that when we're not feeling well? Let's say, a lot of our patients, our melanoma patients, they're not feeling well because of the treatment, they're not feeling well because of the cancer. And then there's also the struggle with the feelings that come up, and there's this disconnect, right, between how they're feeling and how they want to feel. So how do we bridge that gap when you're not feeling physically?
Such a good question. And it's so hard. I mean, first and foremost, we manage the symptoms, right? So if fatigue is taking you down, that's a conversation with your doctor about what are the things I can do to better manage my fatigue, because you can't think your way out of fatigue. Fatigue is a real physical experience. However, you can think about how you spend your energy. And you can include your support system, whether that's a partner, a sibling, a best friend, in the conversations around helping be the buffer, right? So they may be that buffer so that your energy is conserved for what fills you up and what feels good, and let them be the one that takes that hit or takes the energy. Empower them to be the one that contains you and gives you space so that you can be your authentic self in the space where you feel safest. And again, cancer gives a great excuse for reevaluating relationships, and it also provides an opportunity for the people who love you to step forward and take on different roles. And oftentimes people say, what can I do? How can I support you? How can I, show up for you? And many times, especially women, will say, I got this, we're good, just like pray for me or send me good energy. And what we really can do is ask them to check in on us, right? Give us compliments, send us messages during the day that make us laugh, send us notes that help us feel comfortable and confident in who we are. Be the buffer of negativity so that they're absorbing it instead of you. And most of the people that love us really are willing to step into that role.
That's amazing, because I'm hearing you say it also in a different way. We've heard many other speakers say it's about self-discovery. So in a way, trying to understand who you are as a person and how to adapt the world around you to that, how to build your circle. I'm a very introverted, shy person, so it would be hard for me to ask for that kind of thing. What's your advice for people who are like, we're just shy people, we're introverted, and we don't feel comfortable asking, even when people say, oh, I want to help, and you're like, oh, I can't. How do we do it?
So I think there's a couple approaches. One, usually an introverted person has an extroverted person in their life that they trust.
Okay. I get that. Yeah.
And so you can let your extroverted person know what you need and let your extroverted person be the one that asks, right? So usually we can use the person that's in our life and vice versa. The other would be, one, it's normal to be uncomfortable, whether you're extroverted or introverted. It's normal to be uncomfortable asking for help. We, especially in America, we are like independent, got this on my own. I'm not going to acknowledge I'm suffering. I will never acknowledge that I'm struggling with my body image, especially if I'm a man, because that's like unheard of. It's not cool. Men don't struggle with that, right? Which is crazy. That's actually completely untrue. And when we can lean on the people who we do trust, so whether that's the extroverted person in our life that can be the buffer, or really stretching ourselves. And that is an opportunity to stretch ourselves and let the people who love us show up for us. Because what often happens is when we don't let them, when we don't say, here's something you can do, they're on the outside when they want to be on the inside, right? They're asking how they can help because they want to be engaged. And we, whether it's in survivorship or in our treatment, we've missed opportunities to let the people who love us in and to help in a way that could actually be helpful to us.
Wow. So you could, every introvert does. Now that you think about it, I do have some extroverted people in my life, so I'm going to go to them and see if I could rely on them too. That's a great tip. We have, thank you so much, Minda, for commenting too, that there's also apps, right? So I didn't know, we haven't talked about this before. So Minda uses something called Ionacare, which is apparently a platform for family caregivers. But what do you think about using technology and apps to help you connect and
so important. So there are so many, there's Caring Bridge, there's Care Pages, there's so many really wonderful tools out there that allow people to show up for you, whether that's virtually and in another state or that's nearby. And I always say, as a patient, assign a quarterback to manage that, right? And because it is hard when you're feeling fatigued or you're nauseous or you're not feeling great, or you just don't want to necessarily feel that vulnerable, to have somebody who can quarterback that and say, Sally's really struggling with the scar on her face and she could use some things that uplift her, right? Where you can be honest and transparent, but allow people to message you back. And same with asking for what you need, whether that's prayers, funny emojis sent to you, YouTube videos that make you laugh, right? Things that lift you up during the day, because it's all tied in, right? And when we're in that negative space, whether that's a body image negativity, whether that's a sexual image negativity, whether that's just depressive thinking of my world is black right now, having the ability to receive messages that are uplifting, that make us laugh, is really important in our journey, really important.
Yeah, so I guess it's not so much the technology, it's just whatever resources you can find in your environment. And that's also part of the self-discovery. It's something that could be very local. There's national and other types of resources as well, right?
Absolutely, absolutely.
When do you think, we've talked a little bit about sort of this, going back to the image idea a little bit about just feelings of grief about, where you were before and where you are now. I think that's a big thing that I see a lot of our patients, deal with during the treatment. Again, we're talking about the treatment a lot, but really underlying that is sort of like what they were in terms of their vigorousness or something about their personality, the image. And then now it's changed because of the melanoma. So how do we deal with those types of things?
So really important. One, as a sex therapist, people don't come to me when life is good, right? They come to me when something has hit a hard point, a crossroads for them, whether it's individually or as a coupleship. And the same goes for a cancer diagnosis, right? There is, when you get a cancer diagnosis, people are not like, oh, phew, it's just melanoma, right? There is, oh my gosh, the C word. It is transformative, no matter what kind of cancer, transformative in the way that we feel about the security in our bodies, the security of mortality. Our younger patients with melanoma, right? The idea of having a cancer diagnosis in their 20s, 30s, or 40s, they maybe haven't faced the fact that they are mortal beings. And that can change, right? You could be in your 60s and have your first grandchild and just want to see that grandchild grow up. All of those things are related to grief. The loss of what was into what is currently. And it doesn't mean that grief stays with us in a way that is holding us back, right? Because you can have grief and be very hopeful. And I think that's really important for people to understand, that we can have both. We can grieve what was and be hopeful about what is. We can grieve what our body used to be and be courageous or resilient in what it currently is. I can grieve every time I see the scar and be grateful that I have today? It can be both. And I think sometimes we limit ourselves so much, especially when we talk about our body, because body image, especially in the United States, we are so dismissive of it, especially as we age, as if that's not important or we shouldn't worry about it. And every time we start attaching shoulds to any statement, I always say we're shoulding on ourselves, right? This, I shouldn't feel that way, I should feel this way, which usually leads to nothing but shaming and exacerbating the grief. Where if we say, I can be distraught about the scar I have to look at every day that reminds me of my cancer. And I am so amazed at how resilient my body has been in through this process, right? Or every time I see the scar, I'm reminded of how my body has changed. And I have the ability to change how I respond to that. I can wear a turtleneck if it makes me uncomfortable. I can talk to a plastic surgeon if I need it to be looked at. I can have a different conversation with my support group and ask what other people have done. There's always the and I think that part sometimes we miss, that we just sit in the grief or we sit in the shame of like, I should, instead of the and of it can be both.
Yeah, and that's amazing, because we talked about this, like in leadership seminars, they say never use, but use and here we are looking at the and word. And so if I'm understanding you right, it's like when you're saying holding two conflicting emotions about something is okay when you use the and word, like instead of using the but. So, trying to be grateful, even though there's something that's, really not something that on the surface wouldn't feel like there would be anything to be grateful about.
Yeah, I think
trying to hold that.
Yeah, as humans, we have incredible capacity for emotions, and we limit our understanding of them of just being one, right? I can be angry and happy at the same time. So we can have both. I don't know if any of you have watched the animated video, the animated movie Inside Out. It's one of the best movies, I think, out there, where it talks about the complexity of having all these emotions. And yet again, when we talk about the way we feel about our bodies, the way we feel about our sexual selves, cancer, without question, changes that for everyone. We don't walk into cancer thinking like, we might walk in saying, I'm going to rock this. We're still going to have reminders that go, oh, right. Oh, wow, I have cancer, or my hair fell out, and is it going to grow back the same? It's different, those reminders. So if we can allow ourselves to have both or three different feelings at once instead of judging what they are and just let them be, it gives us a lot of freedom, a lot of breath to then be in conversation with people about what we need, because we can grieve and be hopeful. And what do we need from people in the midst of that? What do I need from my partner when I'm grieving and being hopeful? I need him to approach me gently. I need him to give me reassuring statements. I need him to tell me that I'm beautiful. I need him to make me laugh, right? We can have both.
And is that true for every part of the cancer journey? So we have a question here about survivorship, which is like, okay, I've beat the melanoma, but I have long-term scars. I have long-term side effects from the treatment, these are survivorship issues. And what do we do in those situations? And people who have this supposedly positive outcome, but still feel the effects of that diagnosis and don't feel great.
It's such a good question. And I really, whomever is asking this question, I want them to really understand, what you are asking is so normal. So many people feel this, and feel this like guilt around feeling guilty that I'm not extremely happy that I'm through the cancer, which is crazy. You were given a cancer diagnosis, and that sucks. That changes everyone's life. And we can grieve that. And then we need to think about how we begin to enter into the new post-cancer world. And that means getting to know our bodies again and what can feel good, what doesn't feel good. So the medical and mental emotional damage that you're describing, one, it's really important to seek out additional support. And that could be through a therapist, that could be through a support group, but finding an avenue that allows you to voice that, because it's so normal and it's incredibly brave and courageous of you to say, I'm struggling. And also in that, as you recognize the medical and emotional pieces, what else do you notice, right? So it's getting to know your body again. And when I try to talk to people who are thinking about dating again post-cancer, We can't date anyone until we know ourselves. And so knowing what feels good, knowing what doesn't feel good, right? So the scars that I have on my body, they don't feel good to be touched. I know that because I've touched them. So knowing what feels good and then being able to tell your story. And I'll tell people, practice telling your story with someone you trust. And that means your best friend or a parent or a sibling or the support group, where you say your cancer survivor story. So what on your body has changed, what doesn't feel good. If you're going to become physically intimate, don't wait until you're halfway naked to tell them about the scars, right? Talk to them beforehand about what it looks like, what it feels like, what is okay to touch rather than what's not okay. What is okay? Because oftentimes in our minds, we think about, cancer's changed all of our body. In reality, it's probably changed 1% of our body. And there is still so much more of our skin, because skin is our largest organ, right? It's our largest, and it's our largest sex organ. There's a ton of it. And we sometimes forget that there's so much skin that can be touched, that feels good to be touched. That when we get into a relationship, being able to say, my neck feels really good to be touched, or my legs, being able to direct what feels good is really important versus what they can't, or what's broken, or what I perceive as bad or wrong.
So it sounds like a lot of what you're saying too is, again, about the communication, right? To let people know how you're feeling. So to take that step and the courage to say, this is what does make me feel good. This is what is okay. And I want us to try that. So it's about talking through those feelings and making sure you're heard.
Yeah. And I think as the caregiver, if you notice that your partner is struggling, normalizing, reassuring, and if they're still feeling internally wounded, going with them to a couples counselor to help them work through some of that, because it is not an individual issue. If you are in a partnership and your partner has cancer, it is a partner issue. It is not just a person who has cancer issue. It is absolutely something that affects a partnership. And so being able to find somebody that you both trust to talk through some of those challenges, to reassure, to touch. I'll talk about in sex therapy, I talk about just gentle touching that does not involve sexual touching. It's just sensual touching, just to get people back into the practice of being physically intimate, not sexually intimate, but physically intimate, because oftentimes with a cancer diagnosis, we cut everything off, like everything is done. And so being able to get back into touching and sensate focus, where you're just focusing on what feels good and communicating back and forth to one another on what feels good, is so important.
This is so amazing. I know this is the second time we've had a chance to talk about these things, but I'm learning just a different level each time. And I want to thank you. I know we only have a couple of minutes left, but it sounds like, again, communication, holding multiple feelings at the same time, using the word "and" are really critical. One of the things that was brought up earlier was, do cancer centers have these resources? How does a person go and find these resources in their local places where they are?
Yeah, so a couple of resources. AOSW, which is the Association of Oncology Social Workers, is a great place to look to see if you have any oncology social workers in your cancer center. And then ASECT, which is the American Association of Sex Educators, Counselors, and Therapists, is another resource. And you can go on there. It may not be within your cancer center, but there might be someone locally who's very comfortable having these types of conversations and can help with moving you forward. So both of those are resources. Most cancer centers have oncology social workers who are very comfortable having these conversations. They may not have all the training to get you through it, but they will know how to refer you.
Okay, that's a great way to wrap up. Because we're coming from all over the country, all over the world, and so understanding how to get those resources is real important. Thank you so much. I know these half an hours always go so fast, and I wish we had another hour to talk through all these issues. I wanted to thank you so much, so much for all the advice you've given and in your time today. And I wanted to invite all our callers. Thank you so much for your input. And we'll be really excited in July to talk about how do we get through some fears and anxiety around making treatment decisions. So looking forward to seeing everyone in a month. And thank you so much, Dr. Bolte, for coming today and helping us understand this topic a little bit more.
My pleasure, and thank you all for your participation. I look forward to connecting back at some point in the future. Thank you so much.
Great. And for our callers, what we'll do is, I said thank you so much for writing those acronyms out, and oftentimes we'll post them on the website afterwards when there are resources. So we'll make sure that people can get to those resources. Thank you so much, everyone.
Thank you.
Okay. All right. Take care.